Well, when you come to Sanchez Henry Dental for a head pain consult or a TMJ consult, there's a few things that we do. First, we do a history. What's going on? Second, we do some imaging. We have a CT scanner here. Third, we do a clinical assessment. And fourth, we come up with a diagnosis and a treatment plan. Let me tell you a little bit about the history. I'd really like to hear what's going on with your mouth, with your head, how things have progressed. I'm usually not the first provider that you see. Usually people have seen 5 or 6, even 10 other providers, neurologists, MDs, before they get to me. Let me go through a few things on how I think. If you see this head pain wheel, the happy head wheel is what I call it, there's 6 things that are associated with a happy head. You know, the muscles are responding appropriately. They're activating and relaxing appropriately. You know, the body, how the body responds to things, how your body is absorbing nutrients, how your body is working as part of it. The vessels, your blood vessels, and there's a flow there. There's not a restriction or a pinching off of the vessels. The nerves, they're calm, they're not over-responding or anything like that. The breath is very important, how you're breathing. You're not doing short, panty breaths, you're doing expansion and contraction breaths through your belly. You know, your skeleton is the last one, how your joints are lined up, how your joints are, and health and things like that. When all 6 of those are happy, then you have a happy head. That's how my brain thinks. Just for example, if you have a really tight muscle, an overworked muscle, a spasming muscle, that can pinch a nerve in a vessel. That can cause radiating pain. That happens often in the back of the neck, like an occipital neuralgia. And you can have that pinching there, and then you have pain here, causes there. So as we're going through some of the exam process, that's what I'm looking for. We also do a CT scan. We have a special machine here, an iCat, and I can see from here to here, and I can see sinuses, I can see teeth, I can see a bone, I can see the jaw joints. I can look for other things, constricted airway, and we look at that together. I think it's really important for you to be involved in the process of looking at things, because it's your mouth, it's your body, it's your pain. The more information I give you, the better. Then we go into a clinical assessment. The clinical assessment is broken down into muscular, into joints, into neuropathic, into the nerves, into some of the vessels like a migraine issue. So we look at each of those and we go through a little process. I've kind of thinned out the process or streamlined the process to make it kind of fast and easy, so then we can come up with a diagnosis. After we get a diagnosis, then we can come up with a plan on what's going on. I can't just start treating somebody until I really have a diagnosis. Now, not always do I know where we're headed after that first visit, but usually I do. So I look forward to having you. Thank you for considering coming here, and happy head.